John, one of my favorite things about being in Chicago was you and I got to go and have amazing Chicago-style pizza.
Wait a minute. Pizza? That wasn't pizza, David. That was
Absolutely.
no. That's a vegetable casserole with breadcrumbs, wasn't it?
That's a tremendous Brooklyn bias, John.
No. Well, really, here in Brooklyn, if you had that, you brought that pizza out and you had with a knife and a fork, they'd shoot you in the street right there.
Oh, well, it's time to get this show going, John.
I'm afraid so.
Welcome aboard Lifelines with David and John, your guide to charting the transformative course of crisis intervention and the game-changing 988 Lifeline.
Well, I hope you've got your knife and fork for today's Lifelines, the 988 podcast, where each call brings a new beginning. And as always, we're coming from the heart and soul of Atlanta and reaching out across the country. And today we're going directly through via South Carolina to North Carolina and all the way to where she's physically located in Columbus today. We've got our special guest with us, Joy Brunson-Nsubuga. But John, this is my partner here, Brooklyn, bringing the New York style all the way.
Brooklyn style, absolutely. So great to be with you, David and Joy. So great to see you again, twice in a week. It's fantastic. Yep.
So we're your hosts, and this is your 988 podcast. So watch us on YouTube, like and subscribe, or listen to us wherever you get your podcasts. But today we're going to jump in with our guest. And Joy, you and I have known each other right at 10 years.
Yes. I think it might be a little bit over now, but yeah, it's been
a little bit over. And I know a fair amount about you, but tell our audience, if you will, the podcasting jammers out there, what give them something unique about you that maybe they don't know.
Something unique about me. You're right, David. I've known you too long. So I will say, John doesn't know that I am a minimalist. A
minimalist.
Yes, a minimalist. Meaning that I value experiences over things, and so I am obsessed with tiny houses. I hope to live in one when I retire. I have a capsule wardrobe, the whole thing. I'm hooked.
My gosh, I love it.
So, John, we're going to talk more about that minimalist lifestyle when we get into our segment with Joy. But the other thing we do is we push a little harder and we mention something that Joy is a super fan of. John, you're a super fan of college, high school football, Friday Night Lights. I'm a super fan of country music. So let's take a moment, John. I've got my blank sheet of paper and my pen here.
All right, I'm getting mine too.
What you think Joy's a super fan of? I'm going to say.
Oh, man.
Okay.
Well, boy, now that you've said you're a minimalist, I don't know. But I'm going to I don't know. We'll see. Here's what I'm thinking.
Let's ready? John, on the count of three. Let's see what we wrote. I wrote tiny houses, John.
Oh, please.
Shoes or fashion? All right.
I put shoes because I have seen you wear the most amazing shoes, and they're not the same shoes every time I've seen you. So while you're a minimalist, you've got a great shoe collection.
Well, I cheated, John. She said tiny houses, so I wrote it down.
She did, but I don't. In my mind, tiny houses is what she's going to do when she retires.
Right. So, Joy, what are you a super fan of?
Oh, y'all have made it absolutely difficult.
Tiny shoes.
Tiny shoes. I actually am a fan of shoes. I think one of the things that is probably a misconception is that if you're a minimalist, you don't like fashion or things or, really take hold of certain things. So yes, shoes for sure. I am a fan. I don't have very many. I have like 12 pairs, but they are all fantastic.
So minimal shoes, David.
So, Joy, you started out as a Daymark emergency crisis clinician, and then have worked through clinical supervisor, manager, all the way up through executive and senior executive. So we're gonna talk more with you as we go through our program today. But John, let's start off with telling us a little bit about our sponsor, Behavioral Health Link, and its crisis software platform.
Oh, happy to do that, David. It's just such a joy to have Joy with us today. She's a powerhouse at making sure that door for Recovery International's crisis receiving facility is always open to anyone having a psychiatric crisis. It's no small thing for people in crisis to be able to walk right in or be dropped right off at the right door at the right time to get the right care right now. On the other hand, David, we know it's a different story for many people needing immediate mental health attention when they visit hospital emergency departments. Some waits for a hospital bed can take anywhere from hours to days to weeks in an emergency room, which is an utter disaster for people who are there because they can't wait around for care. That's why BHL's real-time bed registry software can be a lifesaver for people who are in crisis now and who need care now. This module offers live updates on where the empty beds are so mobile crisis teams, emergency department staff, and emergency service responders can find the quickest path to a bed for people needing the express lane on their road to recovery. For more information, David, Joy, and the rest of you, just check out behavioralhealthlink.com.
All right, John, thank you very much. And let's go to our trivia question for the week. So, Joy, we do a classic over-under. And if I can get my Cracker Jack crew to bring up the picture of the week, over under is going to be about our vice president, Kamala Harris. So, Joy, you're leading with Vic Armstrong and some of our team, a Women in Leadership and Diversity, Equity, and Inclusion Summit as a part of the Global Leadership Exchange. And we're going to talk a little bit more about the opportunities of growing in our impact and leadership. We've talked about this phrase, Joy, that leadership is influence, period. John, actually, it's just the week before last that the vice president's husband opened up the national strategy launch at the White House. But the vice president actually herself has broken a record in the number of ties that she has undone in the U.S. Senate. That's the role of vice president. If there's a tie, to break the tie. So she's done that how many times, John?
3.
3 is the record. 3 is the record. So, Joy, since we've had vice presidents, they've been breaking a tie if one existed. You're going to take the over, the under, or you're just going to give up because John called it straight on? It's 3 and you lost. What do you think?
I never call it. No. I would say over.
Over. John, you're not even close this week. It's 33 times.
No, I meant 33 is really, 30 plus 3 is really what I was saying.
I was looking back through prior vice presidents, Gore and Bush and others who were also in that same seat. And 8 times, 10 times, 15 times, but no one's come close. And a lot of those times have been around nominations and things that don't have an enormous amount of import. But I asked our team to find out how many times has it been really consequential, and 2 have been enormous. One of her most significant tie-breaking votes was to pass the American Rescue Plan.
Mm-hmm.
A $1.9 trillion pandemic relief measure aimed to support American families, boost small businesses, and extend unemployment benefits. The other one was the Inflation Reduction Act, and she actually had to break a tie 3 times in order to get that through. So pretty interesting. We sometimes, I think about the vice president not having that kind of impact on a day-to-day. But those
He's the most powerful senator in the Senate.
most powerful senator in the Senate. That's right.
Yeah.
Joy,
Yeah.
what surprised?
I am very surprised. I think I've when I see her or think about her, and she seems to be very behind the scenes and not kind of out front as we've seen vice presidents be over the last several years. And so to know that she's been doing so much work and just hasn't talked about it is absolutely interesting. Wow.
Yeah.
That's pretty amazing. Yeah.
And I think it's maybe hard to look in hindsight because Biden, as vice president, was he more out in front? Again, as we go back through, we know a Bush or a Gore. Well, actually, Gore never did become president, did he? So it's interesting to see. But let's get into our discussion with our guest today, John. And Joy, you and I first met as we talked about. You were a clinical supervisor in our Eastern North Carolina crisis program there in Henderson. But one of the things I wanted to start with is you have referenced drinking the Recovery Innovations KoolAid. And John, we've gone back to our original name, Recovery Innovations. So,
I love it.
Joy, talk a little bit about what that means when you said drinking the KoolAid. What was it about the culture and mission and the sort of, what was that like? What does that mean to you?
Yeah. So drinking the KoolAid, David, probably, I don't know if I've ever told you, that when I came to Recovery Innovations, my goal was to stay no longer than 2 years. Like it was a means to an end. I really wanted to get leadership experience. It wasn't available in the predominant agencies in my area. There wasn't opportunities there. And so when I applied to Recovery Innovations, I got an interview the very next day for a leadership spot. And so I was like, okay, I'm going to stay for 2 years, get my experience, and then I'm going to go to one of these like legacy agencies in North Carolina. And
you were with a legacy agency at the time, Joy?
I was with Southlight Healthcare. It is one of the biggest substance use agencies in Wake County. It is still very prominent there. They do MAT. It's where I got all of my MAT experience. I ran their pregnancy and postpartum program. So it was very eye-opening, but there just wasn't movement or the ability to move up there. And so even though I stayed there for 3 years, loved it, I wanted to make more of an impact on the system. So I applied to RI, Recovery Innovations, and I got an interview and I came over. That first year, I was driving an hour and 20 minutes one way just to get to the facility.
So talk about what that KoolAid meant, though. As
the ingredients in the KoolAid there.
What was the ingredients? We all know.
You came in, and it's not red coloring and sugar and water. You came in, Joy, looking for an opportunity to upgrade your experience, your resume, around some supervisory and sort of get out. But you were surprised you found something that was different than most organizations.
Yes. So I think it started with that first week. We called it New Employee Celebration. When I showed up, there was like signs out front and like balloons and like, we're glad you're here. And I spent a week learning about Recovery Innovations. It was online. Everyone was like around the country. And I really thought, like, what have I gotten myself into? Everyone was so taken by the mission, the staff, the community, everyone I talked to, they knew the mission backwards and forwards, could recite it to me. They let me know exactly what they were supposed to do. I had never worked with peer support specialists before, and as a clinician, I was a little bit skeptical of like, I went to school a long time for this. But being on the floor, because I like to be involved, watching all of the staff work, watching them embody the mission that they were so wholeheartedly believed in, it just I started to change. And so I just have gotten more and more ingrained in recovery innovation. It is not like any other organization I've ever been with. And I guess I have to KoolAid myself now because I hear similar sentiments, especially today. I did a presentation today and they were like, wow, you're so passionate about what you do and we can feel it and hear it. And so it's just something that has kept me here, this mission that we believe in and we go after every day.
And John, that mission, empowering people to recover, to realize their hopes and dreams. But John, it was.
Well, wait a minute, David. I think this is just Joy's very backwards way of saying that she's going to resign at the end of this broadcast.
I hope not.
Oh, okay.
So, John, that mission of hope and purpose and finding one's opportunities, even despite mental health challenges, was primarily one that was focused on serious mental health issues.
Yeah.
And John, you were thinking about, I think, expanding that.
And I thought what was interesting about what you're just saying, Joy, is that you had designs on a slightly different trajectory because your specialist had been in addictions and marriage and family therapy. And I wondered, as you have come to become a leader at Recovery Innovations, has addictions or marriage and family experience influenced your thinking there as a leader?
That is a good question. Absolutely. So for marriage and family therapy, we spend 2 years learning about systems, learning about how they work, how to influence them.
Mm-hmm.
If you move one piece of the puzzle, what happens, what effect it has on every other part of that system.
Yep.
How to create synergy. Like that's what we spend 2 years doing. It can be a parent-child relationship, it can be a couple relationship, or a whole family relationship. We like to have the whole family in the room. That's where you will see me smile. I call it my MFT high when I leave a session and you can just see the pieces have moved around. And so at RI, I do that. I don't call it that because HR says I can't call it that, but I do the same thing with our programs, with our team members. How do you create cohesive team members? How do you look at a system and tell exactly what you need to do? Or when you're considering a change, understanding what impact that change is going to make and have a ripple effect throughout a larger system. So it's just taking my therapy skills and kind of moving it over to more of a program organization level, but it's the exact same skills that I
Joy, I also, that was my specialty was marriage and family therapy.
Really?
And I haven't really talked much about it, but that systems thinking, it was a huge influence on my administrative approach. So it's really, really interesting to hear that that's not just my experience. That actually could be an important way of getting training to be an administrator of systems anyway.
Yeah. Joy, but the second half of John's questions around the background in addiction, talk just a little bit about the work you've done to expand our capabilities at Recovery Innovation.
Absolutely. So the second licensure and training I hold is as a licensed clinical addiction specialist. And so what that means is that I am an expert in all addictions, but substance use is the one that's most relevant for crisis work. And so as we started to expand out, especially building more facilities and looking at that no wrong door approach, one of the areas that we looked at that we weren't serving as well was individuals with substance use. So that was withdrawal management for some programs, But in other programs that were already doing withdrawal management, that pushed us to looking at medication-assisted treatment. As I talked before, I have experience in running those programs. And so one of the cool things I love about Recovery Innovations is that when you have an idea, you can pitch an idea, and oftentimes it's like, well, that sounds good. Let's try it. And so we did a lot of research on how do we do medication-assisted treatment inductions of buprenorphine for opioid use disorder inside our facilities, getting expertise and advice on how to do it, building the infrastructure and the protocols, and then testing it out. It was very successful in North Carolina. And now we've started expanding not only to doing that work across the country. We've added in buprenorphine assisted withdrawal management, which is a different process than we were doing more medication focused on symptoms of withdrawal. We've seen that individuals are more readily accepting of medication-assisted treatment when we offer it to them as a way to support their withdrawal management, and actually staying on Suboxone after they leave. So it's just been a really rewarding experience. But that started, I think we started it around 2019. So it's been about 5 years, and then we've expanded our knowledge and expertise, because a part of it is bringing that awareness to our staff about addiction and what it means, and we've done summits on it. So we've really ran full force with making sure that we're not only experts in mental health, but experts in substance use treatment as well.
And Joy, in addictions care and substance use in general, they are light years ahead of mental health in integrating lived experience in the work. But it must have been a pleasant surprise for you to see how lived experience was integrated into all the work at Recovery International.
Yeah. I would say they are light years ahead as far as lived experience, but there is a lot of different ideas around recovery and recovery pathways and all of that is very different in the substance use world and treatment, and so that's something that we had to work through. But the lived experience lens across recovery innovations is just one that I've seen work over and over and over. And not only is it, in the peer support specialist role, but how we value it throughout our organization with nurses and clinicians, and then also in our leadership and management, and in our executive team as well. So I would say yes.
And our board of directors, Joy.
Board of directors. Board of directors.
We've got John, several. John, we've got several of the, world-leading lived experience pioneers on our board of directors, people like Shelby Rowe and Bill Williams and Pierluigi Mancini. When we first started doing facility work, when Joy and I began working together, Recovery Innovations was really focused on that peer-powered component, the no force first, healing spaces. We looked at some of our competition, our partners, if you will, people like the Connections Health Solutions, who had such a strong medical nursing component, and organizations like Community Bridges, who were national leaders in substance use integration. And right about that same time, all three organizations started chasing that we all three knew we had to have all three as part of who we are. So, John, it's time for some good news. And we had some really great news this week. We were in Chicago. I took this picture just outside of my hotel, but we were a couple of streets over in the Hyatt for that convening of tribes, states, centers, and policymakers. Secretary Becerra was there, Assistant Secretary Miriam Delphin-Rittman threw out the first pitch, John, at the White Sox game.
Yeah, she burned a hole through the catcher's mitt, I understand.
John, what stood out to you at the conference? And of course, Joy, we'll cue Joy up next because she was there as well.
Oh my, it was, it's the first time, and we talked a little bit about last week, David, it's the first time in about 13 years that the entire network has come together, but the first time ever that we brought in all of the state stakeholders and all of the crisis centers, basically the real 988 stakeholders and SAMHSA, naturally, in the federal, and all in one space to focus on this new, crucial, groundbreaking initiative called this three-digit number 988. And it wasn't just great because we were all interested in the same thing, but it's also about how interested we are in each other, because we all, care about the same things, but also care about each other. And I always love to see all of the people who care about the same things in the same space. It was just wonderful hanging out and eating that crappy pizza.
It was great. Joy, what stood out to you in Chicago?
Well, since I am a systems person and I didn't have the pizza at all, I will say
So you had a better time than I did.
I will say what I noticed was just the passion around the detail of the work. There are a lot of ideas and there are a lot of influences and a lot of thoughts that people have on how to make the system work. And so not only are they bringing forward some of the challenges that they're experiencing, but also wanting to share and showcase their experiences, their best practices, all of that. So from a systems perspective, it was a very fascinating time.
Yeah, it was great. And then, John, you and I had a chance to watch a screening of the Steve Buscemi movie starring Tessa Thompson, The Listener. And, it did strike me a little bit of some of those conversations we had a decade ago around making sure we were engaging good contact, which is not only connection, but collaborative problem solving. But generally, overall, man, I was moved by the film. It felt like so much care and support and this just radical acceptance and lifting people up in the midst of when they can't quite see the way forward. So what was your take, John?
Well, again, there's just one actor in it.
Yeah.
Tessa Thompson throughout, carrying the entire thing. And it's just her in her home, virtually talking to caller after caller, providing a wide array of problems. Again, reminding us whenever we pick up that phone, we have no idea what's on the other line.
Right.
And we don't have much time to recover from what just happened. And you go to the next one.
Yeah,
and when people hang up on you, you are literally left hanging.
Yeah.
So the challenges of that role is, again, a reminder of how these are just our psychic superheroes who are just running into these psychic burning buildings, grabbing people by the hands, holding them and pulling them out, and then reminding us that somebody needs to also support them too.
Yeah, it was great. So, Joy, we had a great week in Chicago, but here we are with our guest, Joy Brunson-Nsubuga, Chief Operating Officer at Recovery Innovations, helps drive the supports and services across a multi-state footprint. But Joy, you mentioned you came to Recovery Innovations. You confessed today that you came here for a 2-year stint. But as you got going, you did get focused on not only the mission and culture, but on your professional development. And I'd love for you to talk a little bit, because there was a time when you and I worked on that very discreetly, and you went through a process. So talk a little bit, if you will, about that process and how did that benefit you? Would you encourage others to engage in a similar process? Let's hear a little bit about that.
Sure. I guess I am confessing a lot of things today, or things that were discreet are becoming public. So I would say it was a catalyst for a position that I wanted that I did not get. And my kind of lack of understanding of what a leadership position, like the skills that was needed, the background that was needed, all of that. And so when I did not get the position that I thought I should have gotten, I outreached and we started talking through talking through a plan. And I outreached in a way that was, obviously I don't have the skills that I needed to, but how do I get those skills for the next time an opportunity comes around? And so over that time, it really allowed me to focus on my 5 to 10 year trajectory. And also the skills that I have currently will not necessarily get me to the next level, because the next level is something that is not based on what I am doing today. So that trajectory, I started doing executive coaching, which really unlocked a lot of things. I would really encourage anyone who is looking into moving through leadership to do that work, because it's really not only about developing skills, but it's also about yourself and learning your values and your vision and how does your role tie into that. And making it more about you and your passions versus just a position. And then after that, I did my MBA and completed that over about an 18-month stint. And from there, it was such an eye-opener to realize exactly what I did not know. Even like conversations that I was having afterwards, I was hearing things that I was pretty sure were there before, but I never picked up on them. I never picked up on exactly what maybe a finance department or project management or kind of those types of roles, what they were talking about. So I would absolutely encourage a path where you're looking at that synergy between yourself, clinical, business, all of that, to bring it together to create a leadership type and experience that individuals can relate to and that you can be effective in your role. And to answer your question, David, yes, I recommend it. And yes, I actually talk about it quite regularly. It's especially for clinicians who want to move up. We're no longer in a time where you just kind of wait for the person to kind of move out of the way and then you move up to the next role. We're really looking at business and those business skills and all of those things. So I really do encourage, especially the individuals that I mentor. I have several of them to make sure we're not only looking at that clinical side, but we're also looking at those business skills or training skills or those skills that will impact wherever they would like to go.
You know, Joy, this reminds me a little bit of what we were talking about just a couple of days ago at the conference when I saw you. And you were telling me what was important to you. And one of those things that was important to you was to promote the distinctive role of Black women and women in general in the millennial generation as leaders. And I thought that was particularly, all of that together and the millennial generation in particular. But I'm wondering what all of that means to you and why is it meaningful to you?
It's meaningful for me on multiple different levels. First, I just think the word millennial, when people hear it, they cringe. It just has like a negative connotation to it. I think so. I always joke, this millennial has stayed at the same company for 10.5 years. Just saying. But I think it's because we have a lot of ideas. We have a lot of connection to our younger generations that are coming through as far as our direct care individuals. They are not the same as they were 20 years ago or 30 years ago. We really look at and want this, I would say this lifestyle that's more about personal wellness and considering how our whole life is impacted by work. It is not necessarily about salaries, but it's about being able to live in your passion and do what you would like to do, and then also have kind of this balance of passion outside of work and that being valued, and your leader understanding who you are and wanting the best for you and putting you in roles that will promote your skill set. And wanting to listen to your ideas and being willing to change the status quo, and looking at the status quo just because someone has an idea. And so I think what we can bring to that table is that flexibility, not only in processes and procedures, but also just the flexibility to want to work with individuals and train them up to get to the roles that they want to be in. I have a lot of mentors across RI, inside RI, outside RI, people that just gravitate towards me and I kind of gravitate towards them. A lot of people that David probably doesn't even know about. But it's something about being able to connect, and something about me, I think, resonates with others so that they are willing to ask questions and ask stupid questions and be vulnerable. And we talk about so many things. And so I think the more we have of that and that approachability and that representation, that yes, someone that looks like me can be in the position that I'm in and can work from being in a facility to where I am. I think it is important, and I think others want to see how they can impact RI in the exact same way.
Joy, I think after this podcast, even more people are going to gravitate towards you and ask you questions about this kind of stuff. I can see the magnetism for sure.
So let's shift, Joy, with that in mind to our first word that comes to mind section. So I'm going to go through a series of individuals and give us a quick reflection on how they have inspired or taught you, or what your thoughts are. We're talking about Joy being a senior executive of crisis services. Of course, Recovery Innovations, John, is a 100 million plus national company. So we're talking about leadership. Our work is crisis to recovery. But the business side of that is what, we're seeing across America. In 2010, less than 10% of C-suite positions and board positions in major companies in the Russell 3000 index were women. By 2021, that was up to 22%. So it has doubled over the course of, more than doubled over the course of just a decade. And it looks like at current rates, we'll reach parity sometime as quickly as 5 to 6 years to now, as far away as 10 years from now. So it is really changing. And it's changing in large part to leaders, Joy, like I had the chance to see Michelle Obama at the National Council Conference in St. Louis a couple of weeks ago. And of course, she wrote a book, Becoming, about her journey as a first lady. Your reflections on Michelle and her impact, Joy?
I read her book. I mean, of course, I read her book. I think her impact is just her authenticity and being her genuine self. She made it okay for everyone to just be themselves and to own it. And so those are my thoughts when it really comes to her. She did not change for politics. If you read her book, she did not change for Barack either. She was herself from beginning to end, and so she is just so genuine. And I appreciate that.
Brene Brown, Joy. Brene Brown wrote Dare to Lead. You talked about authenticity for Michelle. Brene was really about courage and vulnerability.
I have read that book too. You have like a view into my bookshelf? I would say I would say for Brene, I think that after reading her book, she made it okay to be not only vulnerable, but a vulnerable leader. You don't have to have all the answers. You don't have to have all the right words at that exact right time. You can say that you don't know. you can seek out assistance. And so I think what I gathered from her was more about living in your truth and continuing to grow, but being vulnerable in that time and just owning where you are. Her book was fantastic.
Yeah. Let's try to get 3 or 4 more in quickly. So just some quick reactions. Joy, Sheryl Sandberg wrote Lean In. Have you read that one?
I don't think I've read that one. So maybe you're not looking at my bookshelf. I have not read that one.
Yeah, that's actually a good one. It was really about ambition. John, I sent Joy the lyrics to 9 to 5 the other day, the Dolly Parton famous song. And there's a great line in it. A lot of it is about, being held down by the man as she's out there working it. But there's this line at the beginning of the song of getting up and from your sleepy head and pouring yourself a cup of ambition.
Is that in your diet? I'll bet it is, Joy, somewhere in there.
Ambition? I hear I have a lot of it.
Cup of ambition.
True, but I hear I have a lot of it.
What about Erica Clark Jones, leader of the Columbus, Ohio ADAMH, Joy?
Words that come to mind, I will say, is that she's a force. She's not afraid to call you up and ask for what she needs. She's in strategy. She's fantastic with strategy.
Yeah. Yeah, and she's got all of those things that you just described as a leader. I mean, everything. She to me is one of the more impressive leaders that I've met in the last year.
Joy, let's get back to the discussion. And we've talked a lot about some of your background. We've talked about being an emerging leader yourself and what is 42. That pathway, which included a 360 experience, Joy. With how many people did you seek feedback from?
Well, okay, so ambition.
Yeah, right? That's not recommended, John.
Then let me get all the
feedback from 8 or 10. Joy, how hard was that when you got feedback from 42 people?
So I thought. I think I had to take a couple days off.
You might as well do it. You did it well. So Joy, let's talk a little bit about crisis leadership and crisis management. So we've got this amazing situation where 5-10 years ago, this was hardly a space that anybody was aware of. And now with the emergence of 988 and a full vision of core crisis care on par with the medical emergency system, it's really moving forward. You and I talk a lot about the phrase standing in your value. Talk about your challenges and opportunities as you're out there working with communities to realize this vision.
Awareness.
What are the opportunities, Joy, and the challenges you're seeing?
The need for them, the desire for them, more than I've ever seen. Getting approached quite regularly, asking questions, emails, all of that on how can we implement this in our communities. We've seen it work, or we want to come see your facilities or something like that. So I would say that's the opportunity is that communities are desiring to have options for individuals that are in crisis. I will say the challenges are around the funding of that. It's not easily funded. It's not a service that can just be fee for service always. It is something that is really, you have to be dedicated to wanting it, but then you also have to be very diligent about how are you going to not only fund the building and start the service. But secondary to that, how are we going to keep these services going the first year, the second year, and then 10 years down the road? It's not just the start of it. It's, you don't want to pour money into something, hire a whole workforce, make a promise to your community that only lasts a year. It is looking at the long-term sustainability of this type of service. And if you're not able to do the whole continuum, then it's scaling it back to something that you can do and then building on that.
Right.
And those are really hard conversations to have.
Yeah, when I think about your work in the community too, Joy, aside from the investment in services, the investment in people with your executive coaching and your relatively speaking therapeutic center business, first of all, I'm intrigued by the name, and I'm curious where the relatively speaking name came from, and if you could tell us a little
Yeah.
the service and maybe a story that's been pretty inspiring that's occurred while you've been running
one of the
it
phrases
and
that I've
the
used
nearly
a
10
lot
years
is that
that
it's
you've
all relative.
established.
Coming from like wow, I was not expecting this question. So one of the phrases that I've used a lot is that it's all relative, coming from like a systemic lens. I used it quite often, and so I have two companies that came out of that. One is relatively speaking, and one is relatively simplistic, which is more on the minimalism side of things, and so that's where the name comes from. But relatively speaking, started as a direct care service and to couples and individuals. As you know, I'm a marriage and family therapist, and now it has morphed into more training and supervision. So supervision for new clinicians coming into the field, being able to have that support. And I think one of the things that they appreciate about my type of supervision is that we talk about the clinical and we talk about the business side, and we talk about like the landscape. I live in North Carolina, so the ever changing landscape in North Carolina. So we talk about all of that over the course of 2 years of supervision. And then I do trainings in person, but I also do webinars that are available for like CEUs for clinicians to be able to get their continuing education just through the website. And so that's really how relatively speaking has morphed over the years. So I'm much more into supervision and training and consultation right now. I think the best experiences through my practice has been has been the training. I have one training that I do quite regularly, and that's the leadership in the field of behavioral health. And it's always very small groups, like 20 to 30 people, a lot of women. And we talk about what are the things that you need to be able to move up. And oftentimes, I remember this one. It was this woman who talked about just being kind of dropped into this position with no training, no support. The position became vacant, and she just was like in line, and they just kind of dropped her in. And I think that resonated because I think for leaders, it's meant to be something that you're trained into, but oftentimes you just get dropped into it and expected to just swim. So being able to support them, she reached out to me through email and on LinkedIn afterwards. So I've been in contact with her, paying it forward. David has offered me like a lot of books. And so I'm like, these are some to read. These are some articles that you would like. And so just trying to give her as much information, recommendations on certificate programs that she could do, but really wanting to make sure that leaders get the training that they need, and it's not this kind of sink or swim mentality. So that's been kind of the fun side of my job.
Well, we've loved watching you grow and develop and increase your impact, Joy, both in the work you're doing as well as in colleagues and peers. I've watched you work at a local level, start a statewide program, start large new programs like the Durham program, work through challenges in Louisiana, and now work on a national level. So it is time, John, for some absolutely true BHL stories.
We need some. I'm not sure if you're the person to deliver it, David, but are you going to give it true?
I am. And okay. The absolutely true BHL story is an actual photograph I took of the Behavioral Health Link call center. So I had been hired to start the center in Atlanta in 2002. As we took over from Willie, who'd been, according to you, John, had been answering the phone since 1966 last week.
Mm-hmm. Yeah, he was the first person to ever answer.
But when I started, I drove down to our main call center. So we had a 24/7 call center in Augusta, Georgia.
Yeah.
And walked in, and there was a red phone. It was actually on the wall. And I'm like, what is right in the middle of this large call, 24/7 crisis call center. And it was just a reflection of my business partner, the founder of Behavioral Health Link, Greg Graham, his absolute insistence on the most important thing in the crisis call center, John, is what?
Well, I would say it's the Commissioner Gordon phone, the red phone.
But why? What is the most important value?
The most important value. Well, I know it's making sure you answer the call.
Answer the damn phone. So Greg, he was so focused on answering the phone, John. He had a red phone in the middle of the call center that if someone in the call center couldn't get to a call, it didn't roll over to some kind of voicemail or cloud. It rolled to the red phone, and anybody, supervisor, manager, assistant, somebody had to run and answer the red phone, John.
Yeah, that sounds really not likely, David. I don't think so.
That story, not only did it happen, John, you were there too. You would occasionally run over and answer that phone, John.
You know what? Now it's all coming back to me, David.
John, it's time for some plain truth.
Let's give it to us. Come on.
You finally took my hand. It took a nip of gin, but you finally took my hand. You can't afford no ring. You can't afford no ring. Say I do and kiss me quick, because baby's on its way. John, those are the lyrics from the country singers, the Chicks, as they serenade about it being past the time for a wedding. And across our nation, John, two main systems offer a lifeline in times of crisis. The federal system, evolving over the last 20 years, began with 1-800-SUICIDE and later shifted to 1-800-273-TALK in 2005. You were there, John.
Yeah.
Spearheaded by SAMHSA, these initiatives have ambitiously aimed to be a beacon for those facing their darkest hours, providing leadership in research, in technology, in communications and marketing. And yet direct funding for these critical services provided at the community level remains notably absent for that federal arm. In stark contrast to the first option, the second option, state and county systems, such as here in Arizona, boast robust access to crisis and local support. Here, it's also a 20-year development within the larger healthcare framework managed by Arizona Medicaid, which is, Joy, a $24 billion annual budget, which allocates over $1.5 billion to the behavioral health system. And out of that pool, $330 million plus a year is supporting the key crisis infrastructure of a statewide call line, mobile crisis services that will go to you anywhere, anyone, anytime, and crisis facilities that are directly accessible. Despite the growth of the 988 system, the majority of crisis calls still, in most of the country, like they do here in Arizona, come through on the local, county, and state crisis lines, with only about 1 in 4 calls here coming through 988. Here in Arizona, Solari Crisis and Human Services stands ready, responding to each call. Nationally, the federal government's 988 initiative leans heavily on our state systems, which often include, here locally, sophisticated mobile crisis dispatch. In other states, electronic bed registries. With the FCC pushing now for the geo-routing of calls to streamline distribution based upon where you're actually at, so you'll get through to that right center, SAMHSA is now urging a shift from the legacy 10-digit lines in states and counties, with everyone now going to 988. This pivot suggests a future we can collectively strive towards, a unified approach to crisis response that brings us all together. But it means it's high time for a marriage. Reflecting on the journey since 2005, when the National Suicide Prevention Lifeline was first convened, it's clear the relationship between federal and state systems has often been more like a casual dating than a partnership, than a capital M marriage. NASBIT has had a seat at the table, but it's often felt token rather than a full voice. And entities like Solari find themselves caught, stuck in the middle. One funded system, the other not. In just 2 years, the momentum behind 988 has surged, with 8 states legislating significant funding boosts in tens of millions coming into those states. The list of states making substantial investments into their crisis line and their state core services is growing, with many joining the likes of Georgia, Arizona, Utah, and others. It's time for SAMHSA to solidify this commitment, to truly unite with the state behavioral health authorities. And we had everyone there together in Chicago. It's messier. Look, it's harder work than it already is to create these kinds of 50 state partnerships, as well as the territories and tribes to work with, to create those kind of capital P partnerships. But that's what's going to get us going to the future that we're all realizing. A great start to this marriage would be SAMHSA facilitating the new 988 Center network agreements with the states being the go-between instead of a third-party administrator. It's a lot of work, yes, but such a union will significantly advance the realization of 988's potential and put the accountability on the full development on the states instead of the centers. So as we all work together, this is the path to get us to that full promise of 988. And with that, John, I would say it's time to put a ring on it.
Oh, David. I was crying.
David. That's some plain truth, Joy.
Yeah. You know, David, states didn't fund centers to answer Lifeline calls for years, and we've been begging them for nearly 2 decades to join the party, and now they're paying for most of the party. So maybe they should have a say in the decorations and food being served. Not too much to ask, is it, DC? So that's it for us today, right?
That's it.
Yep, we got to stay cool, stay anchored, and look out for the lifelines that we toss y'all your way next week. Take care now.